Okay, everybody, thanks so much for joining us. My name is Johanna. I'm a communication specialist over here at BC Healthy Communities, and we're joining you here today from beautiful BC, which I hope most of you are. And we're in Victoria in the southwest corner here. So that's on the unceded territories of the Songhees, Esquimalt, and Wasantic nations. And here at BCHC, when we do that territorial acknowledgement, it's a prompt for us to be a bit reflective about the nature of our work and the colonial roots of the fields we work in, including planning and public health. And even for me in communications, I just use it to think about how colonialism is embedded in the practice of my work and how I can sort of continually shift my practice to be a bit less colonial every time. And that relentless incrementalism is really important to me. And that's actually a great entry point into introductions to you all into the Zoom interface, which we're using for the first time for our webinar. So please bear with us. If you'll see in your Zoom menu bar on the right-hand side, there is a chat box, an option for a chat box. It looks like a little talk bubble and 3 little dots. So it'd be great if everybody could click on that and just take a second there to type in your first name and maybe the territory you're joining us from if you know. So we'll just take a minute to do that now. Hi, Jamie's. Alberta, hey? Oh, that's awesome. Sound isn't working for Doug. Okay. Is anybody else having any sound problems? Hi, Carrie. Hi, Stacy. Hi, Katrina. Hi, Dustin. Hey, Sandy. Hey, Jessica and Claire. Awesome, guys. Hey, Kelsey. Hi, Harriet. Hi, Liliana. So that's awesome. So people are getting a sense of how to use that chat box, and that is perfect. And as you'll see there already, Claudia, our wonderful operations specialist, is standing by, and she'll be diving into the chat and Q&A as we go. So she's your support person if you need. I see she's already giving Doug a little guidance about maybe calling in through a phone line if you're having speaker troubles. Hi, Rhonda. Hi, Tina. Hi, Bob. Okay, so just a little bit more housekeeping before we get started. For those of you who are using Zoom for the first time, you will see that chat box, which we just talked about, as well as kind of in the middle of the bar, there is a Q&A section. So if you want to ask a question, you can do so there. And I believe that there's also an option in there to ask the question anonymously. And as I said before, Claudia will be handling that. And if you want to follow along on Twitter or tweet what you're learning about here today, you can use the hashtag HealthyHousingBC. You'll see it's kind of at the bottom of the display screen here. And just a reminder that today's session is being recorded and it will be up on our YouTube channel a few hours after we finish up here. So if you can think of anyone on your team who's not here today or who would benefit from seeing this, we will definitely send you a follow-up email with that link to that recording so that you can pass it on. So enough from me, let's get to our presenters. We've got 2 presenters today. First up is our very own Sandy Mackey, who is right next to me here, Healthy Community Planner here at BC Healthy Communities. He is a very committed community planner, and he believes that planning is a powerful tool for equitable and socially motivated growth. He is passionate about public discourse and encourages self-reflective planning practices and progressive policy making. He's a graduate of the Dalhousie University Master of Planning and Mount Allison University Bachelor of Arts programs. And he's going to kick things off for us today by reviewing the Housing Needs Reports legislation, the adjunct UBCM funding program, and then he's going to look at some best practices and points of entry for that. So I'll hand it off to Sandy now. Thanks so much.
Great. Hi, everyone. Thanks, Johanna. Yeah, thanks very much for joining, everyone. It is, as she said, a beautiful sunny day here in Victoria, British Columbia, and I'd like to reiterate that we are presenting to you from the unceded Coast Salish territories of the Lekwungen and Masonic peoples. It's very important to my practice to continually reflect on how planning is deeply rooted in colonial value sets. So every time I get the chance to reflect critically on how we define land value and how we define use for land, it's important that I recognize the traditional territories on which we operate. So we'll get going. I know that housing needs assessments and housing are a really exciting opportunity right now in BC. So forgive me if you've seen a lot of this information before, but I think we've had a lot of interest from health authorities and from other community partners in how they can get involved in this process. So that's what we'll be talking about today. A few key points. Again, as Johanna said, my name is Sandy Mackey. I'm a community planner here at BC Healthy Communities. We're a province-wide not-for-profit that facilitates the ongoing development of healthy, thriving, and resilient communities. We offer a range of programs and services, including planning processes, events, and resources that support communities. We also support local governments, health authorities, and multi-sectoral groups to professionals, facilitators, research, evaluation specialists, and of course, communication specialists like Johanna. So we're very excited to be here presenting to you today. Before we get going, this webinar today is brought to you by the Plan H program. Plan H is a program developed by the Ministry of Health and facilitated by us here at BC Healthy Communities. It supports local government engagement and partnerships across sectors for creating healthier communities. And at the moment right now, it's got three key deliverables. The first is local government support, including community grants and project expertise. The second is health authority support, including education, advice, and resource development. And the third is collaborative support. So in all the projects we do, we try to emphasize local government and health authority collaboration. This year, we're supporting 34 communities through our grant projects. And since the program began in 2012, we've supported a little over, it says 199 there, but now we're closer to 250 around the communities around the province, from the farthest north, that's the Daly Dene First Nation, to the southern tip of Vancouver Island. This year, we're especially proud of our new emphasis on rural and small community projects, and we've just developed and implemented a new Indigenous grant stream. So some unique communities receiving project funding and support through the Plan H program and the BC Ministry of Health. Today's goals, first, we're going to do a walkthrough on the new legislative requirements. Not many people are overly familiar with the new legislation, so it's really important to have a background in that before you approach local governments and try to help with this process. We're also going to be talking about the new funding program that is available through the Union of BC Municipalities. And then we'll move on to some best practices, including specific practices to promote and critique new health, the processes that local governments are following, and access points for health authority members. So maybe before we get started, Johanna, if you can pull up a poll, quickly just what health authorities are being represented today, which would be really exciting to see. And so it should just pop up on your screen, and you can just click the health authority that you are representing here today. If you're from outside the province or do not work for a health authority, please click the bottom option. So just give another 30 seconds for the poll. Okay, I think that's probably good. Great, so it looks like we've got almost 75% of our participants are from outside the province or do not work for a health authority. And it looks like the other health authorities are pretty well represented. So that's great. But before we, and as we move forward with our background, I think that's important to note that this legislation is specific to local governments. And a lot of what we're doing is encouraging health authorities to get involved with that legislation and the process of implementing that legislation as much as possible. So this has been specifically designed for people who work in health authorities, but the information that we're presenting here is very useful for other community groups or people who are just interested in how this process is going to work in their community. So the important piece of information is that effective April 16th, 2019, new provincial requirements require all local governments to complete a housing need report for their community by April 2020, and then continue to complete or update that report for every 5 years after. This is a really important piece of housing policy in your communities. It's going to mean a lot for how communities approach housing. This piece is specific to the data collection and the information about housing in their communities, but we're going to see official community plans and other community documents will actually have to include information from this housing needs report. So we'll see the influence of this report throughout most local government policy moving forward, which is very exciting. For those of you who already are working with communities or who have maybe worked with communities in the past, it's also important to note that local governments who have recently completed a housing needs report may have been considered to have met the legislative requirements for the first report. There will be a few criteria that the Ministry of Housing and Municipal Affairs judges that on, but my guess is that they will be looking for data that is using information from the most recent census and and the report is relatively recent, within the last year. If you have a report in your community and you're curious as to whether or not your report will qualify, we'd recommend that you contact the Ministry of Municipal Affairs and Housing. The information is there on the bottom right. So the legislation and regulations specify requirements across two key areas. The first is information collection, and the second is report content. So we'll start with information collection. Local governments will be required to collect about 50 kinds of data, including information on current and projected population, household income, significant economic sectors, and available and anticipated housing units. Information is required for each electoral area to which the report applies, and the only exception is for electoral areas with a population of less than 100. So my guess is that most of you, if not all of you, will be working with communities that will actually have to do this work. But there's some really good news for communities that maybe don't have a ton of capacity. Most of the data that you are required to collect as a local government is going to be provided by the Government of BC. They've put a new website together with a catalog of all the data that they'll be requiring. So that's a really exciting way to start, an exciting way to bring information to your community if your local governments or planners don't already know that. And the second piece is report content. So all housing needs reports will be required to contain some very specific content based on an analysis of the needs and of the information that they've collected. The first is the number of housing units required to meet current housing and anticipated housing demands over the next 5 years. There'll be statements about key areas of local need. For example, in our community, we need more rental housing or more supported housing or more housing for seniors and elders. That would be an example of a statement of local need based on analysis. Number and percentage of households in core housing needs. So you actually have to catalog those people in your community who are experiencing core housing need or extreme core housing need. For some of the non-planners in the room, core housing need is defined as when someone is in housing that is not affordable, appropriate, or accessible. So that means if you're paying more than 30% of your income on housing, you would be in core housing need. Extreme core housing need is when you're paying more than 50% of your income for housing. And that means that you're at extreme risk of homelessness. And then finally, there's a standardized summary form. So what is missing? Well, I mean, obviously, I think a lot of you can tell that's a pretty bare bones housing needs report. So what is missing is a lot of the prescriptive elements on how you would actually collect that information, who you collect that information from, and some of the more, and why you're collecting that information. So that's where the funding program comes in. The government of BC has allotted $5 million over the next 3 years for local governments to complete this work. And it's a really exciting amount of money. There is a lot of money available for communities. You can actually see how much your community or your region is eligible for by visiting the link there. It's listed publicly how much each community is able to receive. And regional projects and larger communities are eligible for up to $150,000 to complete this research, which is a really significant amount of money. So there's lots of exciting things you can do with that funding. And the eligible costs and activities allow communities and their consultants or partners to do a lot more work than just collect those 50 indicators and analyze them. You're able to spend money on public information costs. So creating a more expansive and more accessible document. You can use the money to train and build capacity for local government staff. You can use the money to fund community engagement. So this is an opportunity for local governments to define the processes through which they will engage their community on housing moving forward. So doing that in a really exciting and thoughtful manner at the beginning of the project can have implications for all of the housing work the community is going to be pursuing over the next 5 to 10 to 15 years. So the money is substantial and it's exciting because it's the entry point, it's a formative process. And the funding program is actually, they've actually got the grading up, and they're going to be grading a lot based on some of the areas that I've highlighted here. Demonstrating community consultation and public engagement, including consultation with health authorities, but also with neighboring local governments, First Nations and local Indigenous organizations, nonprofit service providers, and vulnerable populations. The Canadian Mortgage and Housing Corporation has a really good definition of vulnerable populations, and that they're using for the rollout of the National Housing Strategy. So if you want to take a look at specifically vulnerable populations and what they're looking at, that would be a good place to start. The general overview of vulnerable populations is people who are at risk of experiencing homelessness, single individuals, especially single women who maybe have only one income and are raising a family. Also, another key area is people who are experiencing mental health issues or maybe struggle with alcoholism or drug issues, et cetera, et cetera. So the vulnerable populations are quite broad, and there's a real opportunity in this study to create a housing needs report that emphasizes those populations moving forward. And then something else that's really exciting is that there's an ability to include strategies for capacity building for local government staff. This is it's likely to be a one-time funding stream. So communities who are maybe smaller or who don't have a ton of internal planning capacity can use this funding to build their internal capacity so that in 5 years, when they need to do the report again, they don't need to rely on external funding from the provincial government. Applications can also include up to 5 letters of support, which is an exciting thing, especially as a health authority. It's a way for you to directly be involved in the application process. So I actually will show you what the, if this works. So I can actually show you what the application looks like, which is kind of neat. So here we go. This is what the Housing Act Needs Report program looks like for those of you in British Columbia who may be curious. It's fairly normal. There's some regular information at the beginning. And then as you get into detailed project information, there's some places where health authority staff or other community organizations can really do a lot of work to help the application process, specifically with number 8 and number 9. In number 8, they're asking for, do you intend to collect data in addition to the data set that was made available from the Ministry of Affairs and Housing? So this is where they're looking for information on what alternative types of engagement are you going to use? What community engagement measures are you undertaking? Are you going to be distributing surveys? Are you going to be doing key informant interviews? Are you going to be doing focus groups or any other kind of community data collection? So that's really exciting. We'll be going over some best practices as we move forward with this. And then in number 9, they're specifically looking at how you intend to engage or collaborate with the following. So neighboring local governments. Housing is something that transcends municipal or local government borders. People who may live in one community tend to cross borders to access services in another community. People, especially when communities are more regional, people may move to a smaller community where housing is cheaper, but still access services in a larger center. They're also looking for information about your engagement with First Nations and local Indigenous organizations, nonprofit service providers, health authorities, and post-secondary institutions, the nonprofit or for-profit development sector, and vulnerable populations. So as a health authority member, you may have a lot of these connections already. If you do, that's really exciting because you can bring your skill set and your partnership expertise to the local government and use it as a way to get more involved with this process. Okay. So that's about the funding program. The first deadline was at the end of May 2019. We're expecting the decisions to be sometime in September or October. And the second deadline is looking like it's going to be November 29th, 2019. So if you haven't already, if the communities you're working with have not already put in their funding application, November is a great place to start. So be thinking about it now, maybe be thinking about approaching your local planners or counselors, because this is something they're going to have to do within the next 3 years if they want access to the funding, and within the next 5 years. As per legislative requirements. So some best practices. Here's the exciting part. Here's where we get to actually have some fun with this, and where we get to play with the way that we meet those requirements while generating a process that will have the most long-lasting impact on the community. So the biggest thing, and one thing that health authority, especially health authority members who work in the community, are really good at is partnership. The Healthy Communities approach tells us that partnership is one of the most important aspects of building a local planning process that actually supports the health of community residents. So one thing that we would recommend is to look for broad sector advisory committees that include service providers, Indigenous organizations, governments, regional representation, and health authorities, and in addition to other partners. That's really important to have at the beginning of the process. We've got listed in the sort of prepare section when you're looking at getting ready for a housing needs assessment. And a big thing is that UBCM, the Union of BC Municipalities that is giving away this funding, is incentivizing regional collaboration. If you work to do this work at a regional level rather than a local government level, you're actually eligible for far more funding. An individual community may only be eligible for $20,000, but in a regional context, 5 communities may be able to get together and be eligible for $100,000, which is, so it's a lot more money, and it will mean a lot more representative report for what housing looks like in your communities. So that's the place to start. If you're not already working with your local government and maybe sitting on a housing advisory committee, maybe take a look at what that committee looks like in your town. Often they are offshoots of council, so there are housing advisory committees that a single councillor sits on, and see if there's a way for you to be able to sit on that committee or to sit on a specific advisory committee for the housing needs report process. As well, so when moving on to the actual conducting of the report, some best practices for data collection, especially in smaller communities. Statistics Canada can be notoriously unreliable. And the data is only collected for every 5 years. So some of you working in the north or in parts of the interior, maybe, or even in the North Island, it might be very obvious to you that data that was collected 5 years ago doesn't mean that much if in the intervening period the mine or the mill has shut down. So look for work plans that focus on both qualitative data and quantitative data. That's really important because just what the numbers say may not reflect accurately on what the lived experience is in your community. So try to avoid what we call cookie cutter work plans, where a consultant comes in and they do the exact same process in every community they show up to. So look for a consultant that is willing to put in the time and develop a process for your community or group of communities that will give the best representation of what the lived experience is like in that community. And look for consultants that are willing to show up. The money is there, and the money is able to be earmarked for things like travel. So look for consultants that are coming up more than once, are coming up 3 or 4 times throughout the process, and consultants that put the right amount of time and the right amount of value on that qualitative process. And again, it's similarly looking for engagement techniques that meet people where they're at, rather than asking people to come to the process. And look for engagement techniques that leverage community assets. We talk about healthy or equitable engagement in this context, and I'll explain to you in a second what that means for us. And then finally, broad sources of data. So don't just rely on those 50 indicators. That's all you have to collect as part of the legislation. But the funding program allows you to go far beyond that, to collect data that's more meaningful and that gives you a better picture of what housing looks like in your community. So when we talk about healthy or equitable community engagement, we're talking about engagement that meets 3 criteria. First, is it reflective? Reflective engagement requires consideration of the systemic barriers to engagement and practices that may be inaccessible to people. So thinking about who is participating and providing input, and who is being excluded from these processes, either purposefully or due to systemic barriers. Planning has been critiqued for a long time for being accessible to Indigenous peoples, newcomers, youth, and older adults. as well as people with diverse abilities. So it's really important to think on who this process is the most accessible for and why maybe other people aren't showing up or providing comment. Second, it needs to be authentic. So planners and your consultants or your local representatives need to be genuinely interested in hearing what community members are saying, and that they have to acknowledge that the current understanding of the community may have been imperfect. And then third, transparent. Community members are made aware of exactly what they're being engaged about and what agency they have over that decision and why. So it's not fair to tell people that this process is going to solve housing problems in their community, but it is fair to tell them that housing needs report is going to give you a better understanding of community housing need so that you can address it with policy and with practice moving forward. So here's an example of what our organization uses, or one of the techniques our organization used when we do our housing needs reports in communities. Although a lot of communities now are moving away from a housing spectrum towards a more holistic view of the housing spectrum, like in a wheelhouse. If you're interested in the wheelhouse, I would highly recommend checking out Kelowna's Healthy Housing Strategy. It's a really exciting new document. But what we wanted to do is we wanted to make sure that the data and the techniques we were using were going to capture viewpoints from across the housing spectrum. So we laid it out and we said, okay, we're going to do a survey and we're going to do quantitative data collection. That's going to give us a pretty good idea of what most people across the housing spectrum are, the housing situation for most people, but it won't give it a perfect understanding. So to better capture voices from the far left side of the spectrum, emergency shelters and transitional and supportive housing, we also make sure to do a whole series of key informant interviews with local service providers and lived experience interviews with people who are actually experiencing homelessness or who have navigated through the housing system. And that was really exciting for us. Key informant interviews gave us a lot of really interesting perspectives from service providers who routinely deal with challenges in the housing process. And the lived experience interviews were actually, after we engaged with those key informants, they were able to help us deliver the lived experience interviews. We did not have the trust in the community to deliver those lived experience interviews ourselves. But once we built trust with local service providers, we actually gave them a series of lived experience interviews. The lived experience interviews were very similar to our regular surveys that we distributed online, but they were done, there were less questions, they were, language was simplified, and we didn't ask questions about income levels or things like that. So we took a lot of the complicated information out, and we just had, or the information that people may not feel comfortable answering or may not know. And we asked the service providers to deliver the surveys for us as a part of their regular intake or as a part of their regular check-ins with their clients. And it worked really well. We received almost 50 lived experience interviews from people across the region that we were working with. And it ended up forming a very valuable part in capturing some voices that we would not have otherwise heard from in our study. And then lastly, informal engagement was really important. As part of our informal process, we distributed surveys and spent time at the library, at grocery stores, just standing out front, distributing information about our study. Things like going to the library and recognizing that most people lots of people may fill out the survey online, and but that really excludes people who may not be able to access a computer or are not computer literate. So we spent time working with the librarians to answer questions for people who may come in. We put little cue cards at the computers in the library, telling people to fill out the survey if they were interested. And one of the big things we did was that we actually visited every Indigenous band office in the region that we were working with. We did it in person, we did it with very small gifts, and we did it with letters or just asking to speak with people who were there. So that was really effective for us, and we found that that was maybe making ourselves known and making ourselves seen in the community was one of the most important practices that we put in place. And so also great are focus group discussions, interviews, or ethnographic techniques. If you're using any of those are great ways to move forward. And some of the data that we captured was really exciting. Most of these studies wouldn't capture as much data as we did from that far left-hand side of the spectrum, but we were able to get some really great quotes out of this, including the one on the bottom right there, which was really powerful. My husband is First Nations, my children are half as I am white. When my husband went to look for a place or apartment, etc., it was not available. I went to the same place and it was available. Not all places were like that, but there are a few here. One thing that we saw come up over and over again is that Indigenous people in this region struggled to find housing, and they struggled to find housing because they were Indigenous. Race was a key determinant of an ability to find housing across this region. So that was something that we were able to catalog and that we were able to show, and not just show through data, but show through meaningful lived experience and through meaningful quotes. And it's been really, it's been a real powerful tool that local community organizations have had now to take to council and to take to other housing providers across the province. It's been very exciting. So when we do our analysis of the data that we collect, we also have some really important, we use this tool, it's called the universal proportionalism, and we actually give more weight to the feedback that we receive. Even though we may receive less feedback, we try to give more weight to feedback that we receive from the far left-hand side of the spectrum. Affordable rental and homeownership, people who are in that area, that is great. They require less support than people who are in emergency shelter or transitional housing situations. So we always do our best to highlight that experience and to bring that experience forward in our analysis. And this is a tool that we borrow from public health and that we've now kind of adapted to a planning context. And that's what we mean when we talk about incorporating equity into our recommendations. And one of the last processes at the end of your study is that your findings need to be accessible. Lots of planners love looking at a wall of text or a big document with lots of pictures, but it's really important to make your findings accessible to the community at large. So we used infographics, we use relatively simple language in our findings, and we tried to make pictures show the data for us. So things like a healthy rental vacancy is around 5 to 7%, and the vacancy in this region is only 1.3%. Or things like the rents have been rising significantly by 42%, things like that. So look for community profiles, plain language, infographics if you can, or advocate for those at an advisory committee table. And as well, these things need to be action-oriented, so need to provide recommendations at the end. And a really exciting part of this is the ability to build capacity. The grant is designed to build staff capacity so that local governments can repeat the report in 5 years, but look to see if there's an opportunity to also build nonprofit housing capacity, or is there a place where you can lobby for a coalition model where different service providers can get together and speak with one voice. That's one of the things that when we talk to BC Housing, they always like to see, is when they go to a community, can they just go to one meeting rather than going to 10 meetings? Is there a place where all of these service providers, where all the people who might be interested in providing nonprofit housing in their community get together and meet with the purpose of discussing this? So that's a really exciting thing too. And some things to avoid. We talk about, this is a headline from an article that came out earlier this year, and it's in reference to neighborhood plans in Vancouver. Oh, I'm a planner and planning makes housing more expensive. Across, I think, the 10 neighborhood plans that were studied in this, in each one, housing costs went up. And that's because when we plan an area, we generally make that area more predictable. We make it easier for capital and for investment to flow into that area because it is more stable, because the rules and regulations are more easier to see and to play with. So that's partially why. That's the catch-22 of this, is that we need to not just put in these specific planning solutions, we need to put in these broad solutions that will support people across the housing spectrum. It means, yes, doing those regulation and incentivization things, but it also means putting in programmatic elements that support housing providers. That means supporting nonprofit housing, it means supporting cooperative housing, it means supporting across the housing spectrum, and disproportionately putting your resources towards the left-hand side of the housing spectrum. So this is what we mean when we talk about a critical tool. So again, talking about when we're putting policies into place, a lot of the incentivization and regulation tools like density bonusing or things that you see in larger communities would focus on the far right-hand side of the spectrum. It's for people who already own their own home or who have the ability to achieve market housing. But what we're saying is that a systemic approach will disproportionately put more resources into this side of the people who maybe are not able to achieve market housing. So when you do that, you ask, who does this policy or practice benefit? Who does not benefit and why? That's a really simple way to begin that reflective process and begin equitably approaching housing issues in your community. If you're curious, we have a new housing action guide available. It does highlight a lot of those incentivization and regulation practices, but it also highlights partnership planning and other types of housing work that you can use in your community. It's available online or in print copies from select health authority representatives. And I think we've got some time for questions. So maybe I will leave my information up there and I will go to either the question panel, if there is any. It doesn't look like there's any in the question panel, but if anyone wants to, sorry. Yeah. So, questions here. Great. Yeah, so if you are already involved in a housing process in your community, that would be really interesting to hear about. And if you're not, maybe thinking about how you can start getting involved. And if there are any questions, feel free to use the Q&A box to answer them or to ask them. So Sylvina asks, is local government health authority collaboration a requirement by UBCM? The answer is no, it's not a requirement. The only real requirements are collecting that, or what I went over at the very beginning, that are outlined by the legislation. I will say that health authority and local government collaboration is a part of the application process, and it is a part of how they grade and weight the application. Authority are that is one of the criteria that they are weighting and distributing funding with. So it's not a requirement, but it will help your community get a better chance of receiving funding and a better chance of receiving more funding.
And then I see here in the chat panel, we've got a question from Doug.
I'm curious what tools low-income housing managers have to access bank account information. Some of the local subsidized housing is occupied by millionaires living off the interest. In the meantime, the waiting list here is so long that names have not been taken. Doug, honestly, I don't know. I think that in a lot of communities, rent geared to income is a model that has been working for a long time, or different sort of subsidized housing options. Honestly, in my experience, it has not been that millionaires are the ones living off affordable housing developments in their communities. I think that in my experience, people in most communities, it's nonprofit housing providers who are trying to do the best with the limited resources that they have. I'm not that experienced in places like Vancouver. Most of my expertise is in smaller, rural, or regional contexts. But I think that's an interesting question. I don't know of any tools for housing managers to access bank account information, though. And another question from Heather. What is the link between this money and work with BC Housing? Good question. So BC Housing, in our conversations with them, have made it clear that one of the money to nonprofits or to partnerships to build more housing is that they'll be looking for an up-to-date understanding of community housing need. There is no direct connection right now, but a community with a better understanding, with a more comprehensive understanding, and with an up-to-date understanding of their housing need is more likely to receive funding through BC Housing. Sure. And then this one, just for a fun one, let's see. Oh, and from Jessica, would BC Healthy Communities consider putting together a resource with links to best practice samples of successful housing needs reports and assessments already completed by local governments in BC or elsewhere? That is a great question. I would direct you to, if you can, maybe I can go back. Yeah, so this housing guide is actually, it's got all of that in it. There haven't been a ton of housing needs reports completed across the province. Some of the bigger cities have them. Great examples in Kelowna, great examples in the Strathcona Regional District. All of them are highlighted in this guide. It's got best practices, it's got examples of great work that's going around the province, and it's got specifically examples from smaller and rural communities for people to learn from. Okay. So it is 10 minutes after 11. Why don't we put up one last poll before while Katie gets going? So this is, when was the last time you attended a local government meeting? I know that for a lot of us, local government meetings seem very complicated and not that exciting. But the reality is, in most communities, this is where business gets done. And it can be a really exciting place for you to just get comfortable with, and language for you to get comfortable with. So that's a question just to see how many of you, and to see if I'm hoping that most of you attended one in the last 6 months, but I'll tell you that I am guilty of not attending one yet this year. So I'm in the within the last 2 years part. So it looks like over 50% of you have attended one within the last month. So that's great. That means that you're doing a lot of work. It means that you're actively involved, and that's a really exciting thing to see, because that's probably the most important part. I live in Victoria. I have not even attended one since I've lived here, but I have attended them in a lot of the other communities we work in. So I'm strangely more invested politically in places like Campbell River than I am in places like Victoria. So great. Well, thank you very much. If you have any questions about this work moving forward, if you're looking to help or get involved with the Housing Needs Report in your community, please drop me a line. I'm always excited to chat about it. And it's a really exciting time for housing work. And I think that getting health authorities and community members more involved in these processes is going to lead to better information, a better understanding of information, and better housing action moving forward. So thanks very much. And I think we'll pass it over to Katie.
Okay, I'll just share my screen 1 second. Okay, so my name is Katie Hunter. Thanks for that great background information, Sandy. I'm a community health facilitator with Interior Health. I work within the population health portfolio. And today I just want to share a little bit of my experience on how health authority resources can be leveraged to support the housing needs assessment and the housing needs report process. Obviously, like I said, I'm from population health, so that's kind of my slant, but I think there's really an opportunity to leverage our colleagues and other portfolios in the health authority. So I'd like to go through that a little bit with you as well. So first, starting from population health, I think we can really share data from our community health profiles or the My Health, My Community profiles that exist on the Lower Mainland to help inform the housing needs process from a determinants of health lens. So for example, we can link data related to income, education, and employment, which are all reflected in these profiles, to the housing needs reports. Definitely to reiterate Sandy's point, I really see the role I can have is to support local governments to use those equitable engagement techniques to help gather meaningful qualitative data to support the available quantitative data. So on our team, we're all trained in IAP2 techniques, so we can help work with local government staff and the consultants to better understand the community context and help to identify barriers that people might be facing in having their voices heard. So definitely at that end of the spectrum that Sandy was pointing out, with people using emergency shelters and so on. From population health, I think we can play a big role in connecting local government staff and consultants to our colleagues in other portfolios within our health authority that also have an interest in housing. I also think that the housing needs assessment process presents a really important opportunity for cross-portfolio collaboration within our health authority. So it allows us the opportunities to do some education and have some open conversations with our colleagues in other portfolios to better connect the dots between health and housing and help our colleagues understand the role they can play in supporting upstream planning at the local government level. So let me try and just, there we go. When I'm talking about other portfolios, here, I'm just getting a chat. I just want to make sure everyone, oh, I'm new to this. How do I see the chats? well, hopefully everyone, I don't know how to open the chat, so hopefully everyone can hear what I'm saying. When I'm talking about the other portfolios, I'm just going to use these broad titles that I have listed on this slide here. These are reflective of interior health portfolios, and it might look different in your health authority, but I hope it's enough enough information to, thanks Gary, enough information to help you get an idea, a sense of what this could look like in your health authority. So first I'd like to start off with the mental health and substance use portfolio. So I think these stuff are very important to include in our conversations about housing. Often frontline staff with mental health and substance use are participating at the community level on housing and homelessness committees. And so they're very in tune with the needs of people with lived experience, and can be a really great resource to help share those qualitative stories and let those voices be heard. I think it's also important to consider the partnerships that our health authorities, and often this is within mental health and substance use, have with BC Housing and other non-profit housing providers. So when it comes to service delivery and different supportive housing developments, there's often behind the scenes partnerships happening that the public or even us in the health authority aren't seeing. In our health authority, I have found it really useful to be working with our mental health and substance use community administrator. So that's someone who sits in a role that oversees a region of mental health and substance use service provision, because they can help fill you in on some of those background partnerships that might be very important to know when conducting a needs assessment. So in terms of long-term care, I think sometimes this is an obvious portfolio because our long-term care colleagues are responsible for direct provision of housing in a variety of forms of different care facilities, but I don't know if they're always considered. They can help provide information on the number of beds available in your health authorities, or even the relationships they have with contracted agencies who are also providing supported living in our communities. I think when we talk about our aging communities, we all know BC is aging. This is a really important piece of data that can be reflected in the housing needs reports, but isn't specifically required, like Sandy pointed out. Again, acute care colleagues can be a valuable resource. They may, I say may because it could be dependent on how information is charted and recorded, but they may be able to share information with us, such as the number of clients who are discharged without access to a permanent home, or even the number of ER visits related to issues of housing quality and housing accessibility that could be really key in informing the needs reports. We also have staff in community and home care, and they have insights into the housing needs of the clients they serve that might be related to accessibility and affordability, which when we talk about aging populations is also very important to consider, especially as we're trying to encourage healthy aging in place and keeping people living independently in their communities for as long as possible. Lastly, a portfolio that might not be thought about is capital planning or real estate. Usually in your health authority, that will sit within kind of the corporate services section of the health authority. But health authorities actually own quite a bit of land for the purpose of healthcare service delivery and expansion. But it's worth a shot to talk to this portfolio to see how that land might be able to be used for housing partnerships. And now this might not be something that's reflected directly in a housing needs report. I think it's important to have these conversations as we are thinking about innovative models for new housing developments and housing delivery. Your health authority also might be a landlord. So I learned with Interior Health, Interior Health actually has a few houses around our larger hospitals that are being rented at just below market rent until the land is needed for the health authority to develop on. But Again, this might not be something that's reflected in the housing needs report, but I think it's something that's important for health authority staff to consider, and to consider how that might shape policies around rental housing that your health authority could have. So overall, I think that though it might take some digging to find the right person to talk to, I think there's really many ways we can leverage data and resources that our health authorities have to support our local governments to take on these housing needs assessments in our communities. And that's all I have. So I'll stop sharing my screen so I can send it back to you guys in Victoria. But I am open to any questions.
Do we have any questions for Katie? Maybe while we're thinking about questions, I will just launch one more poll. This one is about the size of the community that you live in, because as we've gone over, different aspects of this apply to different size communities. Ooh, we've got some big city folks here joining us today. I know you guys can't see the poll, I believe, until I close out what the numbers are looking at. But it looks like 40% so far are living in communities of more than 100,000. Although we recognize that that doesn't necessarily mean that you work in those communities. Okay, so I'm going to give people about 15 more seconds, and then I'm going to close the poll so we can have a look. Okay. Yeah, look at that. Oh, I want to know who's from a community of less than 2,500. Oh, I have to share the results. There we are. Oh, Stacy, I'm sorry to hear that that's not. Hey, Rhonda from Harrison. Excellent. I love that you know to the number how many people live in Harrison. I can appreciate that precision. Okay, so I'm not seeing any questions for Katie or any other questions generally. So maybe we'll just wrap it up. We are getting close to our time anyway. So thank you so much, everybody, for joining us today. We do have this available as a recording. It will be up on our YouTube channel, probably in a couple of hours. And oh, there's Rhonda saying, awesome outdated stats CAN number. That's hilarious, given what Sandy just talked about. Yeah, exactly. And this is kind of why we're making our case here for doing that more in-depth analysis of your community. If you're looking for any more support or you have any questions that come up after, you're welcome to connect with our team. If you go to bchealthycommunities.ca/team, you can find all our staff's contact information, and you can shoot any of us an email at any time. And yeah, we will have this recording available shortly. We have an evaluation link that will pop up after we say goodbye today. So if you could take a couple of minutes and fill that out, we'd really appreciate it. And then lastly, again, if you want to check out our healthy housing guide, you can go to planh.ca/healthy housing, and it's available for download there. And if you're from a health authority and you would like some print copies, just get in touch, probably with me. All right, guys, thanks so much. I'm going to close the meeting now, and have a great day.